Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. This meeting is being interpreted in American Sign Language by Kelly Turner, and Carlos Saraceda is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. As we head into the Memorial Day weekend, it is very important that we pause and honor those who've lost their lives serving in the U.S. military. All Americans owe a special debt of gratitude to members of our armed services who paid the ultimate price to protect our country. The families of fallen veterans carry the memories of their lost loved one each and every day. Memorial Day is also an opportunity for us to show our appreciation for members of our community who have selflessly answered the call to serve our nation in the armed forces. The significant sacrifices veterans, the active members of all military services, and their families make to protect our freedoms deserve our deepest gratitude. To all the veterans watching this press conference, I'd like to say thank you. Thank you for your willingness to protect our nation during times of war and peace. Thank you for your personal sacrifice, for spending time away from loved ones and putting yourself in harm's way in service to our nation. Thank you for the many contributions each of you make to our community every day. I want to affirm the commitment of myself and my Santa Barbara County Board of Supervisor colleagues to serving veterans in need. Our veterans have served our nation, and it is always our highest duty to serve our veterans when needed. From preventing veteran homelessness to serving veterans with visible and invisible injuries, there is a lot to be done. But please know your county leaders are committed to serving you in every way that we can. There's a very real sense of optimism in the air as more businesses are reopening every day. This progress would not have been possible without the strong support and deep commitment of the 450,000 residents of Santa Barbara County who have embraced the responsibility of protecting each other. Working together, we have bent the infection curve and reduced the spread of the virus. It is a moment to celebrate. Just before this press conference, I was told that more than 600 local businesses had already completed the county's business reopening self-certification process. As these new shopping and dining opportunities become available, it's also critical to remember we must continue to be very careful. We cannot let our guard down. The virulence of this disease remains very real and very active. Our reopening is cautious and careful, being phased in, and not all businesses are yet ready to reopen. They too are ensuring they can do it safely. For those who feel anxious about more people around, please take your own precautions. The community has made great strides in ensuring everyone's safety. We should all continue to act responsibly for ourselves and others. For visitors, we ask that you take the same approach and take the same precautions that you would at home regarding physical distancing, wearing a face covering, and practicing good hygiene. Let's all remember, crowded beaches are closed beaches. The same goes for all parts of our community. We are stronger together only if we are safely apart. Today, I want to highlight a new public awareness campaign led by elected officials and community leaders in northern Santa Barbara County to remind members of the public to wear face coverings. The Protect, Respect, Wear Your Mask campaign urges residents to protect our community as businesses reopen. Leaders from community in the San Ynez Valley, Santa Maria, Lompoc, and Guadalupe spoke Wednesday at a kickoff event in Santa Maria to urge residents to wear masks in order to protect their neighbors as businesses slowly reopen in Santa Barbara County. Santa Maria Mayor Alice Patino, Lompoc Mayor Janelle Osborne, and Buellton Mayor Holly Sierra all participated in the event, along with community leaders representing the business, hospitality, higher education, faith, and medical communities. As Glenn Morris, the Santa Maria Valley Chamber of Commerce CEO, said perfectly at the event, the timing of this campaign is really on time, as we have the opportunity to begin to support our small businesses and restaurants, and as we bring our people back to work, It's critical that we do that in a way that maximizes the potential for success. The last thing any of us want is for cases to spike again and for us to have to move backward and have to reinstitute some of the restrictions and closures we've been living with for this past few months. Mayor Alice Patino also echoed the theme of the campaign, that it's so important to put a mask on or some kind of face covering, not just for yourself, but for people, for respect for other people. I couldn't say that message better myself. Dr. Del Reynoso has some important news to share regarding a new county public health office order regarding face covering. So I'd like to introduce her now.
Thank you, Supervisor Hart. Good afternoon. We are reporting 11 new community cases and 1 prison case for COVID-19 today. This brings us to a total of 1,551 cases in Santa Barbara County today. 1 previously noted case has been removed. Unfortunately, we're also reporting the 12th death in an individual who tested positive for COVID-19. This person resided in the city of Santa Maria and was in their 70s with underlying health conditions. We extend our heartfelt condolences to this community members, family, and friends. We currently have 27 patients hospitalized with 10 in the ICU. Of the 580 community cases, 465 have fully recovered. That is approximately 80% of our community cases. This afternoon, the Public Health Department will be issuing a health officer order to mandate the use of face coverings in certain settings in the Santa Barbara County. The order will take effect at 5 p.m. on Tuesday, May 26th. There are some exceptions, but all individuals must wear a face covering when inside of, in line to enter, or when conducting business through a car window, or walk up counter with any business including, but not limited to, grocery stores, restaurants, pharmacies, and government agencies. When obtaining healthcare services at hospitals, clinics, COVID-19 testing locations, dentists, pharmacies, and other healthcare facilities. Also, when using public transportation, a private car service, or ride-sharing vehicle. All businesses must require employees to wear a face covering at the workplace or at off-site work locations. All businesses must take reasonable measures such as posting signs to remind employees, customers, and of face covering requirements in this order. Face coverings are not required for individuals who work alone in a space that is not regularly visited by the public, such as private office or a single room. If an individual cannot wear a face covering because a medical professional has advised the individual that wearing a face covering may pose risk to the person for health-related reason, or for individuals who have trouble breathing or are otherwise unable to remove face covering without assistance. This order does not apply to infants or children under the age of 13. The intent of this health officer order to require the use of face coverings in Santa Barbara County moves further into stage 2 is to slow the spread of COVID-19 to the maximum extent possible. The full health officer is available on our website at publichealthsbc.org. I am grateful that Santa Barbara County can enjoy the freedom of movement as we reopen businesses and workplaces. But with freedom comes responsibility. I urge you to do your part in keeping our community reopened. Please be diligent in wearing face covering, in practicing social distancing, and in hand washing. Additionally, we encourage our community to take advantage of our no-cost testing sites in Santa Maria, Lompoc, and in Santa Barbara. You can go online to lhi.care/COVID testing or call 1-888 634-1123. This testing option is available to all community members. Wishing you a safe holiday weekend. Thank you.
Thank you, Dr. DeRosa. Next, we'll hear from Santa Barbara County District Attorney Joyce Dudley. District Attorney Dudley has been leading our county's effort to eliminate hidden crimes during the COVID-19 pandemic. Today, District Attorney Dudley will share information with us about how to spot and prevent elder abuse. Thank you for joining us today.
Thank you, Chair Hart. May is Elder Abuse Awareness Month, and so I'm going to spend the next couple of minutes making you aware of elder abuse in Santa Barbara County, but then also giving you some ideas about how you can make a difference. A tragic statement, but true. When anyone is abused, they have to live with the memory of being abused. Most of the time, when an elder is abused, they have to keep living with the abuser. You can only imagine how that must feel to them. Since May is Elder Abuse Month, as I said, I want to make you aware of that. And to do so, I'm going to give you a few startling statistics. In the United States, it is estimated that 1 out of every 10 seniors, that is people over the age of 65, has been a victim of abuse, and that 1 in 5 have been victimized by financial exploitation. As 10,000 baby boomers turn 65 every day, cases of elder abuse are only increasing. Elder abuse sadly remains largely hidden. For every case that is reported, it is estimated that 23.5 are not. Abuse can take many forms, including physical, emotional, financial, and sexual. In more than 2/3 of the substantiated cases, the perpetrator is a family member in a caregiving role, usually an adult child or at times a nephew or niece. That's why now, more than ever, seniors are at risk. Following the COVID-19 shelter-in-place orders, the very first group that was quarantined were people over the age of 65 and older. At that point in time, seniors lost contact with those who could help them. Outside family members, friends, clergy, pharmacists, people who work in grocery stores, people who deliver mail and deliver packages. The seniors are the ones in the back. The seniors are the ones we don't see. Throughout my 30 years, I personally prosecuted people for physically abusing seniors, sexually abusing them, neglecting them, financially abusing them, and I can tell you that they're some of the most despicable and some of the most hidden crimes we have in Santa Barbara County. So now that I brought this to your attention, let me tell you some of the things you can do about it. You can raise awareness of this problem and support older adults in several ways, such as visiting or contacting an elder neighbor who lives alone, even if it's through the glass door, just knocking on the door, seeing them, telling them you're glad to see them, especially this weekend to honor our veterans. Volunteering for a program or organization that benefits seniors. Confronting ageist messages by encouraging positive portrayals of older Americans. And most importantly, in my world, if you see something, hear something, or even sense something, call 911. And if for any reason you're uncomfortable doing that, call the district attorney's office. We have a number that is available 24/7. Bilingual person will answer that phone. They will be an advocate for you, be you a victim or a witness to this crime, and they will connect you with the system and the support services you need. You know, it goes without saying that every person deserves to be treated with dignity and respect. But there's something about our elders that is also to be cherished. Please be the best kind of neighbor you can be. If you see something, hear something, sense something, please call 911 and protect our elders. Thank you, Chair.
Thank you, District Attorney Dudley. We're all very grateful for the work that you're doing to highlight these invisible crimes, and your simple, powerful message of taking action is more important now than ever. I also invited Suzanne Grimacy from the county's Department of Behavioral Wellness to share some ideas about how each of us can feel stronger, healthier, and more resilient during the COVID-19 pandemic.
Once again, we join on a Friday afternoon, not days or weeks into our new world of living within a pandemic, but months in. No matter what our situations are, as individuals, employees, parents, grandparents, youth, business owners who have been unable to open, business owners or essential workers who have not stopped working, we have all been impacted and we have all lost something during this health crisis. For some, the loss may include the gaining of a new perspective, and for others, the loss may be far greater, economic impact or even the life of a loved one. That said, it's so very important to remember that we really are all in this together. I know that sounds cliche and it's been repeated many times, but we really are all on the same mission. We are all working together on the same job, that of ending the risk of COVID-19 in our community. As a community, we have watched out for and taken care of one another before, and we know how to do this. It's now more than ever important that we continue this practice. As exciting as it is to see the creative reopening of the businesses within our community, we still must maintain our safety guidelines and our awareness that COVID-19 is still within our community. We need to stay healthy as a community, and when we're healthy, we can better take care of others. I want to call special attention to the impact that this has had and will have on the youth and children within our community. Many children and youth are already living with mental health challenges, and the pressures created from this has only made things worse. For those without existing mental health challenges, the sheer displacement from routines, loneliness, reliance on social media for connections, which in itself can be hurtful and disruptive at times, the disruptive in their educational routines, which has had tremendous impact on youth. And for some children who are living with existing bereavement, abuse, or domestic violence, additional mental health support will be needed as we re-enter into our new normal. Some tips for parents and caregivers: provide clear information about the situation, which we know can be difficult because it's a changing situation. Limit exposure to the media, create new routines, and connect regularly with your children, as well as other parents and caregivers for your own support. If you are worried about your child's mental health, seek help. Be a model that it's okay to not be okay. Many resources are available for adults and children, including the Community Wellness Team, which can link to counseling resources by calling 805-364-2750. In conclusion, this is an exciting time of visually seeing our movement forward as a community and seeing the amazing creativity of our community businesses. But it remains a time of vigilance if we're going to stop the threat of COVID-19 in our community. And we can do this together. Thank you.
Thank you, Suzanne. And thank you for the Community Wellness team's important work helping our community during this challenging time. We'll now go to questions from the room. Mr. Fish?
This has been brought up before, but just wanted to ask about Santa Maria in terms of the community cases having the largest number by quite a bit, nearly half the community numbers, and of course another death today. You mentioned North County leadership coming out with messages, but wanted to ask at this point where the county's, where Santa Maria is in the county's focus, level of concern, and what's being done to kind of address the city itself, where it appears to be the the biggest community case area.
Sure. So we are concerned with the disproportionate number of cases being in Santa Maria as well. And we have begun conversations with the city's leadership as well as community partners and community members to really look at why is it occurring. And in the days ahead, we will be meeting with various groups to strategize and to look at what we can do together as a community to address those cases.
Just a quick follow-up, any information that you do have at this time, or any guesses why the disparity may be where it is right now?
No, traditional public health thinking would say that the presence of disease is due to a factor of socioeconomic, the outcomes based upon where we live, where we play, where we work. But beyond that, we're not sure. It may be due to a whole complexity of factors that we are not aware of, and that's why we need the community to be engaged in a conversation with us so that we, in partnership, can come up with some viable solutions.
And then I just had one more question, just asking about an update on the Lompoc prison situation, what the level of communication has been in the past week, in terms of recoveries or the situation there. Are you aware of it improving in the past 7 days, or getting any worse? What's your impression on the situation there now, and what communication have you been able to have with the Bureau of Prisons?
Well, on the communication side, I do want to say that things have improved significantly. We have had some very good conversations about collaborating between the county and the prison system. They have offered up a liaison to work within the Emergency Operations Center that will help provide that kind of direct connection and communication. And then perhaps Dr. De Reynoso could speak more directly about the situation in the prison. She would have better information about that, and I'm not sure she's even able to share that, but.
Yeah, so all I can say is that the communication has improved greatly. From a disease control perspective, we continue to have a close partnership with our colleagues in the prison in terms of addressing cases, in terms of disease mitigation. And from a unified command perspective, we have seen an increase in communication, as a matter of fact.
Are there questions on the phone?
Yes, our first two were Josh Molina from Newshawk, to be followed by Tom Bolton, and that may be all the time we have for questions today. We'll see how that goes, but go ahead, Josh.
Thank you. My question is for Dr. Vando Reynoso. The city of Santa Barbara has opened up State Street about 9 blocks, creating a pedestrian promenade, and it's part of their effort to help businesses with their social distancing so they can move tables to the sidewalk. I wanted to know what your thoughts are about creating that long 9-block strip of pedestrian promenade, which presumably could become a gathering spot. Should people wear masks all the time? Do you have any advice or suggestions for people who are very excited about gathering downtown over the Memorial Day weekend?
Yes, so I'm excited to see the recovery process taking place. I share in the hopefulness, in the joy that people have about freedom of movement, and I applaud the city and for being creative and being innovative in making this happen. And of course, as a public health professional, I worry about close encounters, especially when people are not observing social distancing as well as not wearing face covering. So I really encourage everyone to do their part in embracing the freedom, but with responsibility. So please be kind to others and wear face coverings, and gently remind others to wear their face covering. And in all cases, observe social distancing and hand washing. I think together, we as a community can really embrace the freedom that we've been given and advance forward.
Thank you.
Okay, thank you.
Thank you, Mr. Molina. Mr. Bolton?
Oh, we're heading into a 3-day holiday weekend with expected warm, sunny weather. I'm seeing reports, hearing reports that hotels are filling up their rooms. And there's other communities are expressing concern that there would be a influx of people from other communities outside of our county. I guess my question is, how concerned are you about that potential, and what might that mean for the spread of the COVID?
Well, I think the first answer is that the most important tool that we have remains the same. That is social distancing, wearing face coverings, washing your hands. So we're hopeful that our citizens have gotten the message and are going to continue to act and embrace that strategy. And that message has been consistently communicated to every person in the state through different mechanisms. And we're hopeful that if folks come here to visit, that they would observe the same behavior that they would do at home and keep us all safe together by being responsible.
Okay, thank you.
Thanks, Mr. Bolton. Are there any other questions? There are no more questions on the phone. So I want to take a moment to thank all of the county staff who have been working so very hard these past few months, managing the county's response to the COVID-19 pandemic. Dr. Del Reynoso deserves special praise. She and her entire team at the Public Health Department have been working tirelessly 7 days a week to keep our county ahead of this pandemic. Wednesday evening, when the governor gave us the go-ahead to reopen more businesses in our county, Dr. Del Reynoso worked overnight to make sure the county public health order was ready the next morning so that there would be no delay for local businesses that wanted to take immediate advantage of this new opportunity. I am honored to have the opportunity to work every day with such a dedicated team of professionals at the County of Santa Barbara who are committed to serving our community. As always, please continue to practice these 3 simple personal steps each day. Number 1, stay home as much as possible. Remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands very often and for at least 20 seconds. Don't touch your face and disinfect surfaces regularly. Number 3, if you feel sick, don't go out. Isolate yourself at home. If your symptoms worsen, call your doctor or clinic and follow their medical advice. We will not have a press conference next Monday because it is Memorial Day. I hope everyone makes time on Memorial Day to express our deep thanks and admiration to all of our local veterans, active members of the nation's military services, and their families for the significant sacrifices they have made and continue to make every day to protect our freedoms. Many of the wounds our veterans have suffered are invisible. While not obvious at first glance, these invisible wounds are very often serious and difficult for veterans to bear and manage. Every veteran has earned our support and assistance. Our next press conference will be next Wednesday, May 27th at 4:30 p.m. If you have any questions, call the county's call center line at 833-688-5551. Again, if you would like to be tested for COVID-19, you do not have to have symptoms. The testing is free and available all throughout the county. Please call 888-634-1123. Please be safe this weekend, and thank you for joining us today.